Hey guys, Dr. Dilip here, your internal medicine educator at PrepLadder NEET SS. Here with me, Dr. Shubham Sahni, who scored rank 1 in the recently concluded INISS in the DM Medical Oncology category. So I personally, as a faculty and as an ex-student, I can understand how difficult it is to get into the top 5 to top 10 rank, that too in a competitive exam like INI. And in that way, like the whole PrepLadder team is really proud of the hard work that is put by Dr. Shubham to achieve this wonderful rank. And let us greet Dr. Shubham first. Welcome, Dr. Shubham.
Thank you so much, sir. Thank you for the kind introduction.
No, actually, my words are very honest. Like it's not easy to get a top rank in a All India Institute AIMS. And I think you're an undergrad student of AIMS Rishikesh, and you have done your post-graduation in general medicine in AIMS New Delhi.
Yeah.
That itself is saying a story of how hardworking you are. So that consistency is what is paying off. So to be honest, I've seen so many people, I've interviewed so many people. So those who are really good will have that consistency. And it's not like people who are one-timers, going to just score one first rank in MD or one first rank in DM. So it's going to be consistent. These guys are someone who are going to be consistently hardworking. I always believe that people like you cannot rest without hard work. Hard work is something that is imbibed probably in your day-to-day activities itself.
Thank you, sir. That's very kind of you.
No, I feel so because I myself kind of a person who doesn't do, if I don't do anything even for a single day, I feel very bad. So that is something that is ignorant of any medico for that matter. That too, for top rankers, I always believe that this kind of hardworking tendency is going to continue for years and decades together. And first of all, why did you choose medical oncology in the first place? I've seen people who choose cardiology pretty easily, nephrology is very attractive. Even hematology, rheumatology, endocrine is very attractive. I feel some people telling medical oncology is not that an attractive field, because the results are not always going to go into your way. So what made you choose medical oncology?
Right. So basically, when I started having rotations through all the specialties during my postings at AIMS New Delhi, I realized that I was kind of attracted towards each and every specialty wherever I was posted. So when I was in gastro, I was kind of inclined towards taking gastro, and by the end of gastro posting, I was like, I want to do gastro. And by the end of neuro posting, I had almost decided I have to do neuro. So it was, you can say I was not really loyal to a particular branch. But when I was rotated through medical oncology specialty, I realized that probably it provides the best of all worlds. And, you're not really restricted to a particular specialty. So at one point of time, you can be treating a gynecological malignancy, while the next moment you'll be treating a hematological malignancy, and the next moment you'll be dealing with maybe a pulmonary malignancy. So that kind of variety kind of really attracted me, and my perception of oncology as a branch wherein there is almost 100% case fatality kind of changed completely when I had my rotations through oncology. And I realized that, in my BMT rotations, I found out patients were surviving for years altogether, coming after 20 years of follow-up, touching the feet of our consultants and saying, thank you for saving my life. So that kind of really attracted me, and I found out that it's not really what we think during our undergraduation or post-graduation. And also, I'm a person who's kind of inclined towards research, and oncology provides a variety. And perhaps I feel and I predict that it is the field of the future. So that's why I chose oncology.
To be honest, yes, what you have said is absolutely true. So people always think not 100% fatality, but even most of the MD general medicine candidates, even if they don't do the medical oncology rotation, they always think medical onco is something that has more than 50 or 60% fatality. And it's very difficult to treat patients because most of them come with end stage. They don't understand about the concept of screening early. For most cancers, picking up early, and to be honest, more than 2/3 of the patients tend to present early stage cancers rather than in late stages, that too with the advanced modalities of screening. And that too, with hemato-oncology, what you said, things have been very advanced. We think acute leukemias have a very high fatality rate, but I've seen in my own practice, there are so many people with AML and ALL who survive for very long, even after a bone marrow transplant. If they survive that initial storm of induction chemo and the initial first year of BMT, they tend to do very well after that. So medical oncology, like as you said, it's a good field of research because the future is all about genetics. And you tend to have like so much of
Right. So,
opportunities.
right. Right. And while I was sitting in oncology OPD, like I had 2 months of rotation. So I realized that whatever we study in the books, all the next generation sequencing, analyzing it, that actually comes into practice perhaps in the only field that is oncology. And I have never seen, I mean, I haven't had a rotation wherein there was so much of, conglomeration of the basic specialties and actual application into clinical medicine. So that's what really fascinated me. And I perhaps, if anyone wants to choose oncology, that should only happen after having a thorough rotation, maybe a month or two in an oncology unit, and then only deciding on, zeroing on onto this branch.
Yes, to be honest, that's absolutely right again. You are spot on because like you take anatomy, like you have integration with oncology, you have physiology, whatever the basic sciences, right from your biochemistry to your pathology to your pharmacology to whatever specialty you're with, it is integrated with oncology. Plus, at the same time, you have like all the systems like coming up with oncology. You're not restricted to any one particular organ system, right? So you're going to see like everything, like right from hematological system to your surgical branches to surgical onco system. So everything is integrated with medical oncology. So
Right,
it's like, I mean, that's the reason I wanted to hear from your like perspective, like why did you
right,
choose medical oncology? Because people still are not like very much into medical oncology. And coming to the main part of the
right,
interview, like, because like we wanted to know like how did you prepare? Because doing residency in a central institute is not that easy. Like I understand like the amount of pressure that you'd have gone through during your like residency, and you would have had very limited time to prepare. And how did you really do that? So what are ways of preparation? Is there any tips for the people who are preparing for NEET SS right now and INSS?
So, I that reminds me of my interview back in MD days when I had gotten into MD at AIMS. So at that time also I was asked this question, what was your preparation strategy? And my answer at that time was that it's not really a preparation of 1 or 2 months. Perhaps it's an entire process. And the result of that process is, that single day when you give that exam. So as I told you that whenever I was rotated through all the specialities, I was kind of attracted towards each specialty. And by the end of each specialty posting, my main aim was that I should be thorough with the basics of that particular rotation. So, say for instance, when I was rotated through neurology, my main focus was that I should be thorough with basics of neurology, localization, uh, disease localization, etiology, the major disorders that we had, starting from movement disorders, headache, stroke, and all the basic things that are there. Not going to much hi-fi stuff. And when as a process, when I was rotated through all specialties, I was basically thorough with the basics of each specialty. Of course, whenever we are working in a busy institute, it's not always possible to cover everything. But then, whenever we see patients or whenever we are doing daily day-to-day activities in that unit, we kind of imbibe many things, and we end up learning a lot of things which ultimately help in the exam. So that because uh, from this time onwards, general medicine is a very important component of INISS. In fact, from the last two exams. So just being thorough with the specialty and only mugging up the specialty part won't really fetch you very good marks. It might get you a good rank, but for you to get a seat at a central institute into the top 5 or the top 4 people, you need to be very thorough with the general medicine aspect as well. And I feel that general medicine is what made the difference this time. So oncology part, like this time, it was pretty basic. I would say, anyone who has been rotated through an oncology unit would be able to answer most of the questions. But general medicine part, I feel, was a bit trickier. There were questions from oncology in the general medicine part, which would be common for all. So there was a question on pancreatic cancer in general medicine part. So your MD rotation will help in the long run. And I feel that one should not run after very hi-fi things or hi-fi diagnosis. Maybe learning around 10 or 11 points about amyotrophic lateral sclerosis will not help you, but basics of spinal cord localization will help you both in your internals, the finals, as well as the main exam, because that's what they're going to ask. So that's what I feel, that medicine, perhaps the reason why we took up this branch was love for medicine, and reading up medicine and revising medicine should be the first thing that any aspirant should do. Once you're thorough with that, maybe in your final year, you can actually focus on the specialty that you're trying to aspire for, and try to go through at least basics of that specialty. So by the end of my fifth semester, I had basic oncology knowledge, not that much because again, it's again thesis has to be done, and then final exams are also underway. So by the end of my MD, I was thorough with basics of oncology, and I ended up scoring a rank 7 last time in IMSS of November 22 when I gave it with my final professional exam, and that time I missed it by 0.33 marks. So, so that's when I decided that I had an option of taking up JIPMER, I had an option of taking up other aims, but then my aim was actually in Delhi. So then I joined oncology department only on a non-academic position at AIMS Delhi, and by side I was preparing for oncology. And this time, fortunately, it yielded good results.
No, I would not say it's fortunate. Like fortune favors the brave. Like I would say in medical field, like fortune always favor the people who are hardworking. I never believe the word fortune, to be honest. I always say like fate is something that you make it. It's not like something else, or like universe is going to like make the fate. It's always like
Yes,
we
sir. That is
we
absolutely
are in control of our fate, always, almost all of the time. Maybe like where we are born, or maybe where we are initially growing up, maybe like kind of fate, or maybe kind of luck or probabilistic. But once you are in the zone, after that, everything is under your control. So once you get
that
into a
is true.
medical field, once you get into the grip of the MBBS, like from the moment you enter into MBBS, from the first year, I always feel like it's in your control. It's in nobody's control, because you're an adult, you're grown up, you have a good thinking
Right.
capability. And that's why I say like you're not fortunate. It's always, I feel like it's your hard work, like your determination. You have been even like you have missed with 0.33 marks, like you have not given up, you have not joined any other institute, you just wanted AIMS New Delhi, you joined medical oncology rotation for 1 year, and that would have helped a lot, right? So like, because working alongside with the department that we wanted, like really is going to help. You'll be learning a lot, like along with the department, more than what you're going to learn from the textbooks. That itself is going to give you a lot of confidence.
That is true, sir. And I always feel that uh, my seniors have actually given me this advice that whichever branch you want to take up, if you're really unsure about it, you work in that place for 6 months or so. I joined the department. I think I worked for almost 5 months only, and I gave the exam. But by the end of 5 months, I had the confidence that yes, I want to do oncology because this is what I want to do, and I really enjoyed the posting. And B, I ended up gaining a lot of knowledge, and that really helped me in the exam because the exam was very practical, I feel.
Yeah, AIMS exams is always known for its practicality. They're going to ask stuff that you're going to do in day-to-day life. So that's how most of the like AIMS papers, as far as I've seen, very few papers maybe like are theoretically oriented, but like most of the papers, if you see the last 5, 6 years, whatever they ask, like it's what you do in your practice, like what you do in your day-to-day life. So that's what they're going to ask. Like most of the things are going to be very basic stuff. But the problem is like people are not exposed to the basics, and people are not learning those basic concepts. That's the reason why they lag behind when it comes to central institute exams. And yeah, so coming to the next question, what are the like sources that you have done to get into this good rank? So what are the books? What are the other sources? What are the MCQ sources? Like you need to have some source, right? So to have a base like on that, on top of that, where you can build up.
So I think I'll divide this answer into two parts. One is a source for medicine, and the second is source for the subject specialty, that was oncology in my case. So for medicine, I feel, and I'm very frank about this, I did not read medicine in the last months of my preparation at all because I did not have the time. I was working, and I had to study oncology, which was a specialty which had. So I did not touch even a single bit of medicine, maybe barring a few BLS and ACLS protocols and maybe basic stuff that they might ask, and I was purely relying on the previous medicine knowledge that I have. And trust me, it is the previous knowledge that will come handy. So ultimately, you have to use your deduction skills, exclusion skills, inclusion skills while solving MCQs on the basis of the past knowledge that you have had. So during my MD, I basically focused on reading the major topics from Up to Date, which is an app which is provided by AIM. So I mainly read it from Up to Date as well as adding it with Harrison. So I had already read a major part of Harrison during my undergrad. So during postgrad, I mainly read the topics which I missed at that time and added to it excerpts from Up to Date and or important topics that are not very well given in either of these sources. And so by the end of MD, I think I was thorough with medicine. I would not say I knew all medicine. I knew basic medicine for sustenance and maybe good enough medicine to pass my internal medicine final exam. So because as I told, high-fi things are not exactly needed. We have to be jack of all trades, master of none kind of thing. And for oncology, so that was for medicine. Mainly had it and a few review articles. And for oncology part, basically, I would suggest that anyone who's aspiring to come to AIMS should basically focus on dealing with general oncology, hematology, and basic solid cancers. So, general oncology, I think the best source is reading from Devitas. So, a good, thing would be to read the first 750 pages of Devitas, mainly the old Devitas. So the new Devitas, which was launched recently, has removed all the initial chapters. So you can go through the previous Devitas that was the previous edition, like basics of epidemiology, etiology, carcinogenesis, molecular basis of carcinogenesis, very basics of polymerase chain reaction, next generation sequencing. In fact, not just basics of next generation sequencing, also interpreting an NGS report. There have been questions on that as well. So going through these basics, going through hematological malignancies thoroughly. So you can go through Harrison, you can go through up to date either, depending upon how much time you have. And solid cancers, I think the common solid cancers are prevalent in our country. You should be aware of the basics of management of that. So, for instance, like there was a question on anal carcinoma this time. Now, one would not expect you to know very thorough, knowledge about the NCCN protocols or what would you do in scenario A, scenario B, but you should be aware what causes anal carcinoma, what are the risk factors, what for staging, how do you work up a case, and what are the basic drugs used in the management. So this time they asked as to what are the drugs that are used in the management of anal carcinoma. So, likewise, you should be aware like lung carcinoma, carcinogens, acute as well as chronic leukemias, maybe prostate carcinoma, colorectal carcinoma, stomach and pancreas. So these are the important key two focus areas that one should focus on while preparing for a subject like oncology. And I think 80 to 85% of the paper will be from this only. Rest 15% will be something which will judge whether you have worked in an oncology unit or not. So I think that was my preparation strategy.
Yeah, actually, what you said is like, again, absolutely true. The previous edition of Devitas with regards to basics was much better compared to the current edition of Devitas. Current edition of Devitas, I think, is concentrated more on the systemic oncology part rather than the general oncology part. The previous edition, though, is like most of our favorites. Like not only just students, like even like most of the medical oncologists also would have liked the previous edition of Devitas, I think, comparatively. And up to date is also beautiful source. Like for oncology, especially, like
Right.
there are like plenty of other sources that are available, like more than up to date. But up to date is a brilliant source, like what you said, uh, like you have like all the details of the medical oncology treatment. It's not good for surgical onco though, but like for medical oncology, it's too good. Like including the modern staging systems, the different like the current chemotherapy protocols, like everything is like too good and up to date, including like the side effects of each and every regime, like everything is like given in a very good fashion. So I think like I mean, you have used the excellent sources and that tells in your rank, man. So your rank one. So that's the reason you have put in a lot of hard work. So you have said like, I didn't have much time to read and I am fortunate, but look at what have you done, like how much you have done basically. Like you have read through Devitas, you have gone through like a lot of different sources, you have worked in the medical onco department, and what more you really require? That's what my question is. So that's the reason from the very beginning I'm saying like that you're not fortunate, you have done so much
Yes,
of hard work, like get into
that is
this.
true. Basically, one has to tailor their approach mainly based upon the amount of time that they have. So, the competitive exam preparation is never, testing how much you know. It tests on how much you can absorb that information in that very short period of time that you have. So a person who maybe has 2 years of preparation or has worked in a college unit for 3 years.
It's actually correct. Like to prepare for a competitive exam, like first of all, you should have all the basic knowledge with you. Like what you said, like I used to emphasize to my residents also, like if you want to become a good specialist, first of all, you need to be a good internist. If you don't want to be a good internist, you cannot be a good specialist. So you
Right.
cannot focus on just one particular specialty and just go to the exam and crack that and become a good specialist. Like first of all, you should be aware of what all going on like in that particular field, in that broad specialty field. Then you can focus on what is required and then you can go into that path. So always like never ever ignore like the other specialties, like go into all the specialties, learn everything about everything initially, and be very, very thorough with the basic diseases and the basic things that will be asked in exams, and that is important for your practice as well. Then move into the particular specialty that you're interested in, like which you're going to choose ultimately. And seriously, like this is one of the honest interviews I've like done. Plus at the same time, like it's a very inspiring interview for me also, because like you have nailed everything, like whatever is required for a resident to be done. So like you have just nailed it. Nothing else.
Thank you, sir. Thank you,
And
sir.
no problem, no problem. Thank you, Dr. Shubham. And we from PrepLadder team, like wishing you all the very best. Like you're going to have a wonderful career, and we have absolutely no doubt about that. And once again, thank you very much for the interview. It's great.
Thank you, sir. Thank you so much, sir. Thank you.
Thank you so much. Thank you so much, Dr. Shubham. Bye-bye. See you.
Bye, sir. Have a good evening.
You too. Bye.